Doctor, we welcome you to the program. Good to have you with us today. Let's talk a bit about your background, first of all. How did you get involved in medicine and specifically specializing in your field, which is nephrology, which we'll find out more about?
Sure. I'm actually a product of the local universities. I'm at the UC Irvine graduate, both as an undergraduate and a graduate student. Medicine has been my passion, and as somebody who went through both medical school and graduate school, my interest has been in the field of vascular and metabolic diseases, and that's how I ended up with the kidneys, which is a vascular and a very metabolic organ.
You actually have an office right nearby at the Alton Sand Canyon Medical Office right there in Irvine, right near the big hospital there in Irvine, so obviously quite close to our folks here in the community. We're talking about the kidneys today, and I think some people maybe think they know what they are and where they do. I believe they're located in the lower back.
That is correct.
Above the buttocks, sort of in that area?
That is correct. That is correct. Your kidneys are pretty much as big as your fists. So if you make a fist, that's how big your kidneys are.
You have a pair of them?
You have a pair of them usually, about I would say 98 and 99% you do. There are some people who are born with one kidney, but the usual scenario is everybody has two kidneys.
And what do they do?
Kidneys are very complicated organs. I would think that kidneys are probably next to your brain in terms of the complexity. In a nutshell, what they do is they cleanse your blood of the waste product of the metabolism of your body. So you eat the food gets digested, the digested material somewhat gets excreted through your colon, but some through your kidney. Obviously, you urinate, and your urine is another form of toxic material that gets excreted. Kidneys are also functioning as part of your endocrine organ. There are hormones that are released from the kidney that they play a role in blood pressure regulation, calcium, phosphorus, and hence bone health. And most importantly, kidneys they play a pivotal role in managing your blood count, your red cell blood counts, because the hormone that is released from the kidneys helps your body make blood.
So they're not just a filter?
So they're not just a filter, that's correct.
A lot of functions, lots of important things about them there.
That's correct.
A lot of times people complain about having pain in the back, and sometimes that's just from too many golf swings or picking up those grandkids or overdoing the gardening or something. But sometimes that could be symbolic of a kidney condition, correct?
I think you're right in your earlier statement that probably 99% of back pain is from musculoskeletal strain. Kidney diseases by far don't cause any pain. The two conditions that are well known to cause pain that come from the kidney are kidney infections and kidney stones, both of which cause excruciating pain. So if you have that kind of back pain, you would be in the emergency room, not at home.
Right. Well, let's talk about some of those diseases that can affect the kidneys. You mentioned kidney stones. I guess that's kind of a scary thought to most people, and we hear somebody saying, "Oh, I passed a stone," or "I had to have surgery, to deal with that." What causes kidney stones?
Kidney stones are, first of all, we hardly do any more open surgeries for kidney stones. But kidney stones are basically a function of your body metabolism and how your kidneys actually handle what's coming to them. In the older age group, kidney stones are not as prevalent as it is during your 30s and 40s. So if you've gone through life in your 30s and 40s and you haven't had a kidney stone, the likelihood that at your 70s and 80s you form a kidney stone is quite low. Probably the best and most effective way of dealing with kidney stone is to prevent them, and drinking plenty of fluid to keep the urine flow going is probably the best way of prevention.
All right. Now you mentioned infections. What can cause kidney infections?
Kidney infections are usually infections that you have in your lower urinary tract from your bladder.
So a bladder infection could lead to a kidney infection if not treated effectively.
That is correct. That is correct. In the 70s and 80-year-old of life, what could happen is urinary retention in males because of the prosthetic problems, in women because of the relaxation of bladder after that can happen after years of after you pass your birth
Right,
age.
childbirth or
Childbirth age.
postmenopausal.
Correct. Those two conditions can cause bladder infection or can predispose you to bladder infections and hence to
Right.
kidney infection.
I know in some cases that can be a sign that somebody maybe has to have that prostate looked at and maybe even surgically dealt with or otherwise because it's causing that bladder infection. It could be symbolic of a different problem.
That is correct. Especially in in males, it would be very unusual to have bladder infection. So a man who comes down with a bladder infection, that needs to be looked into.
Right, right. We seem to hear women having bladder infections more than men.
That is correct, and physiologically, that's the way it goes. Especially in younger women who may experience more bladder infection than
Right.
men.
You mentioned that aging, if we get through our 40s without kidney stones, that's probably not going to have a problem with that. But you mentioned some of these other problems we can have. We also hear about kidney failure, and we hear about that at various ages caused by a variety of things. Do the kidneys shut down completely, or is there sometimes just a reduction in function?
Kidneys are. Let me just take a step back and give a bit of a background to this. Your kidneys overall are less than 1% of your body weight. So if you're about 200-pound person, your kidneys are less than 2 pounds. Now,
Two fists.
2 fists. And however, they receive about 20% of the blood that comes out of your heart. So imagine how much your muscle mass is and how much your kidneys are.
Yeah.
Yet they get 20% of the blood, every pump of blood that comes out of heart,
Right,
20% of those are
right.
the kidneys. So kidneys are highly, highly vascular organs. There are a lot of blood vessels in the kidneys. And if you were to reward the word of aging, you would probably call it vascular disease. Aging is basically your blood vessels getting old in the heart, in the brain, in the eye, and in the kidneys. So what can happen is that because of the process of aging, your kidney function can decrease because the amount of blood that goes there can decrease. The two most common conditions that cause kidney disease are diabetes and high blood pressure, both of which are vascular diseases. They probably account for about 85 to 90% of kidney diseases.
Right.
The smaller portions are probably some autoimmune diseases of the kidneys that again usually happens mainly in the younger years of life, as well as some hereditary diseases that are usually also captured during the younger years of life.
If somebody's seeing a change, I know one of the questions they always ask, are you having any change in your bowel or bladder habits? Change in bladder habits, one way or the other, more or less, could be indicative of a kidney condition, perhaps.
Not really. I
No.
mean, if you're in a hospital and you're sick enough to be in the hospital, then the change in your bladder function could be very important. But if you're at home and not sick enough to be in a hospital, it really doesn't. In other words, you can be down to 10% of your kidney function and still urinate the way you did 5 years ago.
Yeah. I know in hospitals they actually measure urine output following surgery for some people just to make sure everything's functioning correctly.
Correct.
Okay, let's talk about prevention. You mentioned enough fluids. Some people say 8 to 10 glasses of water a day. Some people say just drink when you get thirsty.
Right.
Some people say avoid caffeine, like my cup of coffee here. Some people say avoid alcohol. Some people say drink sports drinks that have electrolytes. Some people said stay away from those. Some tips on keeping our kidneys healthy.
I think first and foremost is to apply common sense. There is no magic bullet. There is no magic formula. There are certain kidney conditions where you drink 3 liters of water, but for the overall, what I usually tell my patients is you may have kidney disease, but you don't have brain disease. The stimulus to drink water comes from your brain. Having said that, going through life, we may end up, being so busy that we forget, to keep ourselves hydrated. So, a balance of what your body tells you and, what you are told either by your physician or you notice yourself that you haven't had enough drinks. In terms of food, alcohol, caffeine, common sense again. Everybody knows 5 cups of coffee is probably not good for you. Everybody knows that 3 shots of vodka every day is probably not good for you. But if it's a glass of wine, okay, sure it is. And no matter where you are in the spectrum of kidney disease. Keeping your weight healthy is extremely important, because again, the kidneys have to help with the metabolism. So the more you put on them, the faster they burn out, if you will. If you have diabetes, if you have high blood pressure, which again, you know, in the 70s and 80s category, probably high blood pressure is very prevalent. So controlling that blood pressure is very important.